Welcome back to Midday Kentucky, everyone, and well, it's Colon Cancer Awareness Month comes to a close. We invited Dr. Sandra Beck from UK HealthCare to talk about the importance of a colonoscopy. Welcome to the show, my friend.
Thank you.
Where do we stand in America when it comes to colon cancer?
In America, we're doing pretty good. Actually, the incidence of colon cancer is going down across the country, largely because we are doing colonoscopy screening. Here in Kentucky, though, we're in the top 3 for deaths related to colon cancer. And
one of your notes was saying that cancer is the leading cause of cancer death in Kentucky. Mm-hmm. I'm surprised by that. I really thought breast cancer and...
No, unfortunately, colon cancer, there's a couple of reasons. One, we're a relatively poor state. A lot of people either don't have health insurance, they don't get the screening test done. They also, we have a big population of patients with something called Lynch syndrome.
Explain that.
So they have a genetic risk for developing colon cancer plus other cancers. Oh. And so there's a big population of people who carry that gene that puts them at increased risk, but a lot of people don't know that they have it.
Okay, Dr. Beck, I just want to go back to something you just said. Because we're living in a lower economic area, we can say that people don't have health insurance. Is there no service that allows you to have screening?
Well,
like, you know how they do free mammograms in October, September, October, I believe it is?
You can do the blood test for your stool to see if there's blood in your stool, but really the gold standard is the colonoscopy.
Yes, of course.
And so that one, it costs money. You have to do a bowel prep. You have to have the test. Usually you get some anesthesia with it as well. And then if we take biopsies, there's a pathology fee. So if people don't have health insurance, they oftentimes can't afford it.
And it's expensive when you're doing these type of things.
Right.
Is it a hospital procedure or a medical center procedure?
It can be done in an outpatient center.
Okay.
Some are done in the hospital as well, depending on the other illnesses that you have.
All right, so let's talk a little bit about it. What does a colonoscopy actually show? That's important to know.
Yes, so a colonoscopy allows us to do 2 things. Number one, we are able to actually put a camera up and look all the way to the very beginning of the colon, and then we examine it as we come out, and if we see polyps, we can actually remove them.
Yeah.
If you remove a polyp, then it never has a chance to become a cancer.
Okay, that's the important thing. So, okay, what happens if something shows up?
If you do have a large polyp and it's removed, you're good. If it is a cancer, then they refer you to somebody like me, who is also a surgeon, who would go in and take the cancer out. Okay.
And I've said on this show over the last month as well about my father, who has colon cancer, and he's no longer doing cancer treatments. It's something that I would like to ask you. What other treatments are out there that people can have, and what are the ones that people should be having if you have
colon cancer?
Colon cancer.
So the mainstay of treatment is surgery. Usually in most patients, 70 to 90% we can cure completely just by surgery alone. If you have a more advanced cancer, it's gone to the lymph nodes or other organs, then we also include radiation and chemotherapy along with that.
Well, let's talk about that for a moment. Is when you have chemo and radiation therapy, is it the same side effects as if you're having another form of cancer treated?
No, all cancer drugs are not equal.
Right. For
colon cancer, mostly the side effects are some numbness and tingling in your hands and feet. Most people don't lose their hair. Some nausea and some bowel disturbance like constipation or diarrhea.
Okay, I understand. All right, I wanted to ask you a little bit about diet.
Okay.
Okay, because there's a lot of conversation out there. My father didn't drink or smoke, fairly healthy bloke, you know, farmer,
right.
Just, you know, a run-of-the-mill guy. Never checked it out, but I always thought he was pretty healthy.
Yeah.
Is there anything that we could be doing when it comes to dietary conditions, or?
There's some thought that a diet high in fiber, low in red meat can help protect your colon. But colon cancer is largely a disease of your body kind of wearing out. So 90% of people have no family history. Patients often say to me, I don't want to get a colonoscopy. If it's not broke, don't fix it. However, if you wait until you have symptoms, then the disease is probably advanced at that point.
Okay, I understand. Well, if you want to find out more information about Dr. Beck, there it all is up on the screen for you now. Look, for someone who's about to have a colonoscopy, myself, I really do urge everyone to go out and give them a call. UK HealthCare, there it all is up on the screen. I'm not at that age where you should be screening. I think they say 50 is the common practice now as well.
Well, it's age 50 or 10 years before your relative was diagnosed.
Yeah, tough one.